Good afternoon, and today I have a very special guest, Dr. Alex Volchonok. He's, we can say, biological periodontist. Good afternoon, Alex.
Hi, Dr. Marina. Thank you so much for having me on the podcast here. This is wonderful. I appreciate the opportunity.
And today we're going to talk about very hot topic. Can saliva testing predict the disease before the symptoms appear? And we're going to talk about cavitation technique, what cavitation surgery is all about. Now, something what really close to my heart, ozone therapy. Why ozone so important? What in that ozone, what can help patient to have a better gum health? And we're going to talk about biological dentistry with approach through the dentistry to systemic health, or I would say connection between medicine and dentistry in a gum care. We're going to discuss personalized periodontal care, salivary diagnostic, oral systemic health, cavitation surgery, ozone therapy, zirconia implants, and minimally invasive gum rejuvenation. So I'm going to introduce Alex to you. Alex to my audience. Alex, periodontist, and he graduated from Columbia program, really very well respected. And he had a lot of training in Europe, where they have such a different approach to dental health. They look at the dental health through the whole body. That's what we're trying to bring to United States. So my first question to you. Traditional periodontics usually treat gum disease when they have a full symptoms. Bleeding, bone loss, loose teeth. How salivary diagnosis can change our lenses? Please tell us from your experience.
Of course, yeah, it's a great question. And I would say that probably from the standpoint of periodontal treatments and in diagnostics, salivary testing is really a game changer. It's the first time we're shifting from reacting to a disease process to be able to predict a disease process. And you made a great point. So you said, typically as a periodontist or a patient, you look for certain symptoms. We would look for pockets to form around teeth, or we look for bleeding or mobility, or we look for bone loss on an x-ray. These are all signs that something bad already happened. All right. And what is the thing that drives all this? Well, what we've learned over the last 40 years in periodontics is that it's about a dysbiosis, or a shift from healthy bacteria in the mouth to disease-causing bacteria. And salivary testing is the key to be able to detect that shift before it causes the disease process. And so it's one of the most important tools that we've implemented in our practice, and something that I think is very unique as a biologic periodontist, that we look at the microbiome as a predictive indicator for disease process. And we treat patients accordingly to that risk, not just according to the symptoms that they would have.
This is wonderful. That's so great what you mentioned. But as a general dentist who also study perio in dental school, we learn what we have a lot of different bacteria. Yes, I do periodontic, salivary testing in my practice as well. What I learned, but our microbiome is so unique. So please share with me and with my audience, with our audience, what's so special about certain bacteria, what you're looking for. We talk a lot on my channel about Porphyromonas gingivalis, how terrible is that, but I learned what some people have Porphyromonas gingivalis even after the therapy we offer them. So tell us, what are your red flags on that test?
Yeah. So when we do salivary testing, it will break down the bacteria into different risk categories in terms of how pathogenic or how likely this bacteria is to cause a disease process. Some high-risk pathogens, one of which you mentioned, P. gingivalis, is a very important, very significant pathogen in the periodontal world. I would say that I put it in category also with Treponema denticola and Fusobacterium nucleatum, which is a medium risk pathogen. And these pathogens can create a problem not just in the mouth, but they're also invasive, meaning that they're able to get through the gum into the bloodstream, into the body, and can affect other organ systems. And just like we as human beings have evolved over millions of years, bacteria have been here not only long before us, but they've been evolving continuously alongside with us. And so they've evolved mechanisms to be able to evade the immune system and sometimes even trick the immune system. And that's one of the key things with periodontal disease, is that the bacteria activates the inflammation process of our body to break down gum and bone, and it actually utilizes those nutrients for the bacteria. So when we have a healthy environment, we have an environment that's filled with oxygen, and we call these aerobic bacteria. And aerobic bacteria are generally associated with health. But when pockets become deeper and disease and inflammation starts to form, the environment starts to lose oxygen, and it becomes what we call an anaerobic environment. And this predisposes to this high risk, high pathogenicity environment with the bacteria. Salivary testing can help us identify those specific bacteria that are causing those risks. And I would say to any patient that if you see on the salivary test that you have a baseline elevated level of these pathogens, it means that it's worthwhile to look at the proper treatment of this, the proper periodontal treatment of these pathogens. Now, Dr. Murray, you made a very good point. You said that sometimes even after treatment, we may find that these bacteria persist. And I see that too. And what we need to understand is that bacteria, even pathogenic bacteria, are naturally part of the oral environment. But we need to bring them to the lowest possible levels so that healthy bacteria can flourish and populate. Because it's all a tug of war, between healthy bacteria and disease-causing bacteria, and we want to shift the ecosystem towards health.
Beautiful work. So I'm going to ask you now specific things. Let's talk about this mystery, cavitation surgery. Of course, in our society, I can be agree with that or disagree. A lot of dentists offer wisdom tooth extraction no matter what. Sometimes it's necessary, sometimes, maybe can be avoided. I want to keep mine as long as possible. Some of them I already lost, but some of them I'm holding on. So tell me, what exactly cavitation surgery? How we have to be like Sherlock Holmes, look for what and why?
Yeah. Well, cavitation surgery refers to a finding that we see on a 3D X-ray called a CT scan. And essentially, it indicates an area in the bone where we see irregular, immature, or incomplete healing. It shows up as a black space in an area that we should have bone. And sometimes dentists really are not aware of this term because most of conventional dental education is based on looking at two-dimensional pictures. That's what we were taught in dental school. That's the standard of care even today. The problem is that you miss a lot of things. You miss infections on teeth, you miss periodontal disease, and one thing that we very, very commonly missed was that we'd see that areas where wisdom teeth were removed actually did not heal the way we expected. And why did we miss it? Well, once we remove the wisdom teeth, there's really not much reason to go look there, one. Two, a conventional dental x-ray would not show it. But in the biologic community, we always try to use the most advanced diagnostics for patients. And so we've started using 3D scans early on, and we were seeing this anomaly in the bone healing that other dentists were missing. And we were saying, what is this? And we came up with the term cavitation. And a more modern term to that is actually a CSR, a covered socket residuum. So it's an area where the bone healed like an egg. There's a top layer of bone, but the inside is completely hollow or mushy. And what we can find in there is sometimes cystic tissue, infections, bacteria, viruses, pathogens, fungi, mold, you name it. There's so many pathogens that can build up in this site. And the reason is that either the area was never properly cleaned in the first place, or when it was healing, it didn't have the opportunity to fully heal and certain pathogens got into that site, Or lastly, it can become a reservoir area, especially for patients who have chronic disease, autoimmune diseases, and recalcitrant infections. Areas in the jawbone, like cavitations, are perfect havens for pathogens to hide because there's no means for the immune system in the body to get there, right? There's no blood supply to that area. And so cavitation surgery is all about accessing this area, cleaning it effectively, and allowing the body to properly heal. And that's what
I'm
it's
just
all about.
wondering, when you do that, do you put the bone graft in the area to make sure you have a good foundation, and do you cover it with a membrane?
Absolutely. Yeah. 100% of the time. 100% of the time. So I always bone graft the area, cover with a membrane, because according to biologic principles for healing, that's the best way to regenerate the bone. There has been some thought process that all you need to do is put in a PRF, or platelet-rich fibrin, into those areas. But the problem is that that would dissolve very quickly, and most patients would still have some residual cavitation that form, even if you clean the area well. The best way to minimize that risk is to utilize a regenerative approach to surgery, right? A biologic approach to clean it, but then a regenerative approach to heal the bone. And that's the key to success. And so that is something that I would strongly advise anyone who's looking to get a cavitation surgery. Make sure you ask the surgeon, ask the doctor, will you be regenerating? Will you be grafting the bone? A common follow-up question is, what do you graft with? And there's a lot of variability, and there's some research that's looking at that. But I will say that the consensus now is that it's so important to graft these areas to heal properly.
I have to tell you, as a general dentist who probe the patients, I see pockets behind the second molars being 9, 10. It happens quite often. And sometimes it's become infection to the root. We can call it periodontal. There are, at least for me, I have several explanations to that. Yes, occlusal load being the first tooth would come, but I would become much more careful and look for cavitations in those cases, because yes, we lost some teeth due to that. So you made a very good practical point, and I really hope, people who are listening and who go to the dentist, and they can ask the dentist what's actually measurement behind my second molars, usually on the bottom. I don't know, do you see a lot of cavitations on the top?
We do. I will say that the bottom tends to be more prominent for where we would find it, but no area is immune, and it's not just
Of
something that
course.
happens from wisdom teeth. Any tooth that's removed, if the area is not properly cleaned or fully detoxified, there's the risk that a cavitation can form. And it's a normal part of socket healing. Our body has been designed to try to contract and close any wound. If it's on our skin, we form a scar. Right? In the mouth, it can form a cavitation, and our body's just trying to protect us. But with proper surgical techniques, we can prevent cavitations, which is the most important thing.
Yeah.
And fortunately, with diagnostic techniques and technology, we can treat them if they exist.
This is wonderful answer. Now I want to ask you about ozone. I know you use ozone in your practice. What's so special about the O3 molecules?
Yeah. So ozone is a very, very powerful molecule because it can be used in a lot of different ways therapeutically. First and foremost, remember when we were talking about the environment for periodontal disease, we talk about an environment that lacks oxygen, right? An anaerobic environment. So when we do periodontal treatment and even periodontal maintenance of our patients, we're always incorporating ozone therapy to bring more oxygenation to that environment. Because when you put ozone into that area, it's very reactive, and it'll break up into oxygen and water particles. And so that environment interaction that's happening there is bringing oxygen to an environment that cannot thrive in that. So those pathogens that we were talking about actually will get destroyed if they're oxygenated. So that's the number one benefit. The number two benefit that we utilize, especially for things like cavitation surgery, or implant placement surgery, or any kind of times where we're working specifically on the bone, is that it is a very potent vasodilator, and it promotes angiogenesis, meaning new blood vessel formation. And that is a very powerful concept, because when we want something to heal, we need to bring a blood supply to that area. And the bone does not naturally have a great blood supply like our skin would have, for example, right? And so if we use ozone, what we often see is when we clean that area with ozone, all of a sudden we see this bright, rich red blood coming into that area. So we're detoxifying the bacteria more effectively, and also ozone can permeate really well. So think about all the little pores and little areas in the bone, or even in a tooth, on the root of a tooth, for example, that ozone can penetrate into that area and detoxify those sites really well. So, it's almost kind of like, what can ozone not do? It's such an amazing
No, it's amazing thing, absolutely. But I know for a fact, not every dentist can have ozone. And it was taught on some of the courses, what we took in my hygiene department to irrigate with chlorhexidine. Would it be more beneficial? Yes, of course, use ozone. But if you don't have ozone, use peroxide, diluted instead of that. What are your thoughts on that, strategy?
Yeah. I think hydrogen peroxide works really well too. It'll kind of bubble up and push things out of periodontal pockets, or clean out the area. And in the same sense, it's forming oxygen, right? As hydrogen peroxide breaks down, H2O2 will also break down into oxygen. So you're going to have that beneficial effect. It's probably not as potent as an antibacterial agent as ozone is. And so if you have the opportunity to utilize ozone, I think it's a great idea. I think it's a phenomenal thing for, dentists to get an education in, because it's very easy to apply once you've learned the principles, and it's safe. It's really safe, right? We think about that aspect too. Not only is it effective, but it's very safe for our patients. There's no harmful downside to using it.
No, this is a beautiful story. Now, a lot of my patients suffer. They don't like gum recession. And it's been a controversial topic because, when I was in dental school, we talk about taking, the graft from the palate, and yes, it's painful. Then it was allograft technique, and you use pinhole technique. So can you give us your view on, I would say, evolution of the gum recession treatment process, and your relationship with the different techniques, and what's pinhole technique, what you do?
Yeah. So, in the periodontal world, we treat the gum, and whenever we talk about gum recession treatment, we call it periodontal plastic surgery, because we are working with this very delicate tissue, and we're repositioning and we're moving it, just like plastic surgeons will do with the body for health reasons or cosmetic reasons or whatnot. And so there's so many techniques, there's so many details that come about when we do it. But I'll tell you, one underlying methodology around all of it is the biology. How can we optimize the blood supply to an area to enhance the best healing of that site and get the most regeneration or reattachment of tissue possible? And so there's been an evolution of techniques, everything from utilizing your own tissue from the roof of the mouth, from the palate, to at one point cadaver tissues, then collagen substitute tissues, then even to cellular constructs like kind of made in a lab, and now even collagen materials like what we'll utilize with Pinhole. And what this evolution is really all about is becoming more effective at covering the recession defects and being less invasive. All right, so can we make it more comfortable for patients too? And Pinhole really stands head above all shoulders when it comes to being the patient preferred way to treat recession, because all we will do is we'll make these small little points high up in the gum line to be able to work through to bring the tissue up higher over the root surfaces and cover the exposed part of the roots. because we're not making any big cuts in the gum, because we're not suturing or cutting or sewing, that there's very little trauma. And as a result, there's very little pain or discomfort from the procedure. So it really is revolutionary. It's an amazing, amazing technique founded on biologic principles. We've modified the technique to incorporate the benefits of growth factor therapy, and now even experimenting a bit with peptide therapy to enhance that healing process even more. Because the one thing conventional grafting still holds over everything else is the ability to change the phenotype of the gum, meaning that the genetic quality or the makeup of the gum tissue is determined by the tissues that are there. When we do a technique like pinhole, we're making more of the gum in the existing site that's similar to what's there presently. If the gum is thin and weak, then there's a risk that that can still recede, right? And so that's when we'll still utilize conventional grafts because they're going to be more effective. But I think with the evolution of where we're going with biologic medicine and biologic dentistry, with peptide therapies and with growth factor therapies, I'm seeing that these treatments are making some of these changes and being really effective.
I'm going to ask you the last question. Zirconia implants. What's your view? Why, I would say a lot of people asking about zirconia implants. And I understand why nobody wants to have a metal in the body. But why manufacturers not so widely promoting that, I would say, it's been around for quite some time. Like, why is that disconnect? Can you share with us?
Yeah. Well, I think we're at a very unique time because I think we're moving past the hump in some ways right now where, patients are really asking for it. They're getting more educated. They're informed of the benefits, not only in terms of the aesthetic aspect or, the functional aspect of it, but also the long-term health aspects associated with ceramic implants, meaning that they're not going to corrode. They're not going to release metal ions, both locally and systemically. And so, we're seeing that this is a much healthier implant option. But one thing, there's been a few things that have held up the widespread adaptation because we know there's all these positive things about it. Why are still most dentists trained to place titanium implants? And why are most companies just still promoting that or selling that product? And there's a few reasons. One is that the manufacturing process for the zirconia implant requires certain specific parameters that make it a little bit more difficult to work than a metal. And so it took time to figure out how to make the material strong enough to function in the mouth. And we learned about that when we started making zirconia crowns. All right. And we started to say, okay, there is a way that we can make this a strong material that can deal with the force of the bite. And when we saw that success, we said, okay, look, we can apply this as a new generation of ceramic implants. Because the problem with the older generation of ceramic implants is that they would fracture. This is not a problem with modern ceramic implants. And there's not a lot of surgeons, even, I would say, in the conventional dental world that understand that. They still think ceramic implants break. And so that's, the manufacturers are not making them as much because it's supply demand. If what their customers are asking for is titanium, they'll make titanium. But I will tell you, the more people we can educate, and when surgeons are going to start saying, hey, look, I want to place the best product for my patient's long-term health, the manufacturers will quickly, like this, stop producing titanium and will start making zirconia. So that's, I think it's a matter of time. Realistically, I think it's a matter of time. And there's also an aspect of comfort, as a surgeon, and as a doctor in the biologic world, you and I, we're both looking at being at the cutting edge of our field. We're trying to learn what else can we do to enhance patients' health, right? And we are willing to change. Right. And that's an important aspect that I hope other doctors over time adapt to as well. that if you're willing to learn new things, you're willing to see the latest research and adapt it into your practice for your patients, and even be okay to tell a patient, listen, before I did titanium, but now I've learned new things, and now I think this is the best for you. I think that's a very ethical and very good conversation to be able to have with people, and they'll understand it. And you don't need to worry that now what you're doing is different than what you did before, and you have to kind of hide that. So I think it'll change. I think it'll really change, and manufacturers will start producing more of it. And it's a matter of time till I would say that it's at least an equal option, for patients, if not the best one.
Thank you very much, Alex, Dr. Volchonok. I really appreciate your vast amount of knowledge, and we're going to put information about Tetra Health underneath this interview, and I highly recommend to my audience learn about Dr. Volchonok and visit him. And maybe you have a benefits of ozone therapy or recession or even zirconia implant. So thank you very much.
Thank you. Thank you so much. I appreciate the time.